Hello, good morning, and welcome to Idea Television News. I am Adewale Olashokwan. This is Idea Morning Digest, reaching you live from Idea Television. Idea Television is where you get all the important updates, news, coverage around innovation, technology, science, research, and what have you. This is the place where we have it all in pack for you. And today we have a packed show for you. First, we're going to go through across the headlines, highlighting the major news stories shaping the nation and the world. Then in our discussion segment, we'll sit down with a senior analyst to unpack one of the most pressing issues of the day, providing insight and context that goes beyond the surface. And after that, we are going to touch on what's trending, exploring the latest social, cultural, and digital conversations capturing public attention. And finally, before we call it a wrap for the day, we're going to look at the weather report so that you can know what to expect before you start or as you start your day. I'm Adewale Olashokwan. I'm not alone this morning. I'm joined by the lady without AKA. That is how she introduces herself in other areas. Good morning, Cynthia.
I mean, you just set me off my feet with that. But that's how we start this beautiful morning. Good morning, everybody.
Good morning.
It's a pleasure being with you.
Of course, it's always a pleasure. And yet again, you did not say what day it is. Well,
introduce the show. So, okay.
No, that's not an excuse. Okay. That's not an excuse. You always count the days. Today is 3 years.
3rd of March.
Interesting. Imagine it was 2023. There will be 333. Yeah, well, that's the way we start this morning. Let's look at the first headlines that we're going to be taking this morning. Niger State raises alarm over inadequate data on women's health. Also coming up after that is man backs UNIDO initiative to boost Nigeria's manufacturing efficiency. And in other news as well, Nigeria women in SHARJAH urges diaspora to stay amid UAE missile tensions. But first, we'll take a break. When we come back, we're going to start with the first story. Stay with us.
Enhancing cybersecurity. As cyber attacks grow more sophisticated, cybersecurity technologies are evolving to defend against them. AI-driven threat detection systems, zero-trust architectures, and advanced encryption methods are becoming the new norm. However, keeping up with rapidly evolving threats is a challenge, especially for industries that handle sensitive data like finance and healthcare. The cybersecurity market is expected to reach $248.26 billion by 2024. But the constant need for innovation and adaptation means businesses need to stay vigilant.
Welcome back. We start this morning with our first story. The Niger State government has raised concerns over the lack of reliable data for research into health conditions affecting women, calling for urgent investment in databases and evidence-based studies. The Commissioner for Health, Muritala Bagana, made this known today during a stakeholders engagement organized by Yoteros Health in collaboration with White Ribbon Alliance Nigeria. He said years of limited attention to women's health by policymakers have slowed progress and pledged that Niger State would participate actively in field research and push for adoption of the findings at the National Council on Health meeting scheduled on November 2026. Health advocates at the event noted that inadequate data has kept many uterine health issues hidden. They cited findings showing Nigerian women develop fibroids between 35 and 37 years earlier than in Western countries, and that more than half of adolescent girls experience heavy menstrual bleeding. They called for national screening programs, patient registries, and dedicated funding to strengthen research and policy response. I believe this is an important information, an important news that needs to, not only for Niger State, because we're all around Nigeria, we understand that the data for health, particularly for women's health, we don't have a concrete data that shapes policy or shapes intervention by the state and federal government, the likes. We understand the number of people that we have in the country. In each state, we have at least, the last census that we did, was in 2007 or so. We understand the number of people that are within each state. But over the years, the network has expanded and more people are being integrated into the system in different states and the likes. But we're seeing that the intervention itself is not catering for the needs of the people. A lot of young women are facing health challenges that are preventable. They're facing health challenges that are costing them their lives, and they're facing health challenges that can stop them from reproducing. That means the reproductive health is not being taken care of. So this agency is actually calling on the state government to also look forward to bringing about adequate data, because these are the things that would guide interventions from different states. At the end of the day, we want a society where we have people whose health are taken care of, whose needs are also being met. The primary responsibility of the government, just like we always say, is the protection of lives and property. And one of the ways that you protect life is through good health. And the way you can do that is providing adequate health care for the citizens of your state or for the country. So the state government and also Nigeria as a whole needs to look into that. Adequate health research needs to be made. There has to be collaboration between agencies, research institutions, universities, and also different government agencies to collaborate, put resources together to understand that to understand the problem that we're facing. Because if we do not understand these issues, it's going to be very difficult for us to tackle them adequately. And we're going to be talking about primary health care services that needs to be provided so that we can actually prevent most of these issues. The data mentioned that between 37 to, I'm trying to look at the data right now, between 37 and above face 35 to 37 years face fibroid issues more than their counterparts or more than women in other parts of the developed world. So we're seeing the recurring aspect of that in our society. And before, we used to think about fibroids as issues that affect older women or women that are married. Now we're seeing it in young girls. We're seeing young girls having irregular menstrual cycles. All these are things that affect their health. And it is only through research and data collection that we can understand the causes of these issues. It could be environmental issues. It could be issues around diet. It could be issues around what we experience, the stress level of the society, and the things that they are able to, that they are exposed to at the end of the day. So it is through adequate research and data that we're able to look at all of these issues. We're able to map out the challenge, look back at the things that could have led to it, then think about the possible solutions that can be deployed. Because if we're just providing primary health centers, providing health facilities around a state, that there are not adequate resources for people to actually go into those facilities and get access to adequate health care. There are a lot of facilities today that they are not fixed or equipped with the necessary gadgets or necessary technological materials that would enable the doctors to do their job or carry out their responsibilities. So that is on the one hand. On the other hand, it's also affordability. Healthcare is not affordable, as we've seen that in most cases in the country. We need to make healthcare affordable. If the state can come up with their own insurance scheme that would benefit women that are targeted, because we need interventions that are targeted right now, not a broad based healthcare package from the state, because this report is showing that there is an issue at hand right now, and the only way we can solve that is understanding the problem that we are in.
Very well said, Wale. You cannot fix what you cannot measure. I'll start with that, because women's health has often been, treated as a family issue here in Nigeria. Most of the time when women complain, or young girls complain about some certain issues, it's always treated as a normal case. It's always like, it's a normal thing. That's how it is supposed to, be, instead of us to treat it like a policy priority. So I'll still go back to this being a governance issues. Most of our problems in Nigeria are governance issues, because now if you think about this, say Nigerian women develop them coming out to say Nigerian women develop fibroid between age 35 and 37 years on average, earlier than women in many Western countries. That is not a small detail. That only suggests suggests possible how do they call it? Just like you rightfully mentioned, genetic patterns. It could be environmental issues. It could be even diet. Differences, and even delayed diagnosis too can lead to some of these issues. But without proper registries, without proper structured data systems, we are just guessing, and guessworks can lead to serious health implications and serious healthcare expenses, and it can also lead to late surgeries too. It can also lead to late care and other maternal and fertility complications, and sometimes avoidable hysterectomies. I'm saying this because I've seen what so many young girls are facing of recent. The issue of heavy menstrual flow. Like I said before, if you come in a family, if a girl complains about heavy menstrual flow, you will hear it's a normal thing. Just go and sit down, it's a normal thing. But we do not understand that heavy menstrual flow most times can be a serious issue. It can be anemia, and we do not understand all of this thing. And anemia in teenage girls is very, very bad. Anemia in adolescents is very, very bad. It affects everything, because if you have heavy menstrual flow, you can't go to school, you can't do a lot of things, you can't participate in anything. So one thing again, you mentioned something around I think healthcare, because one thing I've come to understand in this part of the world is that we do not really how should I put it, concentrate or consider funding for women's healthcare, because it is most times taken as just it's just a normal thing. So I think we should consider funding for women's health research globally, not just even in Nigeria, because women funding have received less funding. Women's healthcare rather have received less funding for research and every other thing that concerns women's healthcare. And there are so many cases, aside fibroids and all of these things, there are so many cases like endometriosis that we do not really talk about. It has been understudied, and it is a serious issue. 1 in every 5 women you see, or 1 in every 5 or 10 girls, or 2 in every 10 girls you see are suffering from endometriosis, and it is a very serious case that can even lead to fertility issues that we don't talk about. So I think we should pay more attention to women's healthcare, see how we can channel more funding and research to women's healthcare, and all that will go back. That's why I say it's a governance issue. It will go back to setting the policy right. If the policies cannot shift, if policies cannot shift to favor women, if policies cannot shift to, if the budget line cannot meet with women's healthcare needs, then I don't know what to say. But I like the fact that Niger State is getting committed with field research in this aspect. I think it's going to build a credible database. We are saying, like I started off saying, you cannot fix a problem you cannot measure, and data is very important in this time and age. Even given our population, data is very important.
It's quite important. I was just looking through the data right now about the maternal mortality, because that's also part of the issues that we're facing, especially in northern Nigeria, where we see people perhaps it's now eroding of younger age giving birth. Even people of that are of age giving birth are also falling into that unfortunate tragedy of maternal mortality. And what I'm seeing here is that 1,047 births per 100,000 live births is what we have in Nigeria. That has to reduce. So that also needs to be looked into, because most people going into hospitals, sometimes some women don't get to register doing for antenatal. So all of those are areas of healthcare that needs to be looked into. But lastly, before I go, another thing that I believe strongly that we should also do is awareness. Healthcare as a lifestyle, because often it's not even a Nigerian thing, it's a global thing, that people just look at health as something that It is when I'm sick, you go to the hospital. It is when it's almost gotten worse before you get there. I think we need to reorient ourselves, and that's where the National Orientation Agency, those are the responsibilities that they should be able to carry out to ensure that they reorient people about taking healthcare as a lifestyle rather than something that should be neglected or be taken seriously when matters have almost gotten to worse. So we see a lot of people, I'm sure you are now inclusive, that sometimes it's so something is about to go out of hand before you then begin to go to the hospital to take care of yourself. So when we begin to see healthcare differently as something that is actually necessary, without health, without a good health, we can't do what we do here. Many people in Nigeria cannot be able to do what they do if they're not in a sound mind and health. It is going to be impossible to do that. So we need to reorient people to see how we can take health matters differently. Moving on to the next story this morning. The Manufacturers Association. The Manufacturers Association of Nigeria has welcomed a new move by the United Nations Industrial Development Organization to reposition Nigeria's manufacturing sector through energy efficiency and cleaner production methods. Speaking last week in Lagos at the National Stakeholder Sensation Workshop on the Global Environment Facility, UNIDO, Industry Energy Efficiency and Resource Efficient Cleaner Production Project, the Director of Research and Economic Policy at the Manufacturers Association of Nigeria,